breast cancer. It's the diagnosis every woman dreads. But for today's guest, it was the beginning of a new approach to women's health, one rooted in hope, healing, and the power to take back control. Hi, I'm Monica from AlgaCal, and I'm sitting down with Dr. Elizabeth Boham, a physician, nutritionist, and one of the top functional medicine experts out there. She's worked with women dealing with everything from diabetes to autoimmune issues to cancer. And she's seen what happens when you stop treating symptoms and start getting to the root of the problem. And here's the thing, she's not just a doctor, she's been through this journey of breast cancer herself. She knows what it's like to face it, to fight it, and then rebuild health from the ground up. In her book, Breast Wellness, Dr. Boham shares a straight-talking, science-backed plan to help women protect their breasts, support their bodies during treatment, and heal stronger naturally. Today, we're getting into all of it: breast health, bone health, hormones, detox, and how to take back control of your health in your 50s and beyond. Dr. Boham, thank you so much for being here.
Oh, thank you, Monica. It's great to be with you and to be with everyone. So thanks for having me.
Absolutely. And so before we kind of dig into your book, could you tell us a little bit about yourself, your journey into health and wellness, and what inspired you to really get into integrative medicine?
Yeah. So, my undergraduate and graduate degree was in nutrition and exercise physiology. So, I was always interested in prevention and wellness and self-care and nutrition and food and how to use food as medicine. And then I decided to go back to medical school. And I didn't really know what I was getting into. I kind of thought, oh, I just want to learn more about how the body works and understand all aspects of health and wellness more. And so then went to medical school, and I was just like, oh my goodness, there was no physicians in my family. So I had no idea what I was getting into, and all of the focus on acute care medicine. And so it was tough for me. There was times where I was like, did I make the wrong choice? I really was all interested in prevention and wellness. And now I'm doing this journey, which, made me question a lot along the way. And then I did my board certification in family medicine. And when I was in my residency, I was diagnosed with a triple negative breast cancer. So it was a little over 25 years ago. So I was 30 at the time, and I was doing a breast self-exam and found this mass, which I ended up, going, and I didn't think it was anything. I have no family history of breast cancer. It was it was, 30 is young now, but it was really young back then in terms of cancer diagnosis. It was not very common at all. And so it wasn't something I was really worried about. And I, all of a sudden, even though I had all this passion about prevention and wellness, was now the patient, and thought I was doing everything right? I was exercising. Of course, I was interested in nutrition. So I was eating a good diet, and thought I was really doing everything right. And then I was like, okay, I just have this triple negative breast cancer that then took me down this pathway of surgery, and then chemo, and then radiation. And then when I got through on the other end, I was like, okay, I've got to kind of figure out why this happened to me. Why did I, thinking I was so healthy, and why did I get this aggressive cancer at such a young age? And what could I do to take better care of myself? And what could I do to help my patients as well? And so that's when I was really blessed. I had got a job at Canyon Ranch in Lenox, Massachusetts, and met Mark Hyman and Kathy Swift and Todd Lepine and Cindy Geyer, and I went to my first functional medicine training course, AFMCP, and that was sort of opened my eyes, and I was like, okay, this is really so exciting for me. It gave me the tools and the map, right, the matrix, the way to think about health and disease in a very different way, and understand how all of the different systems in the body are interrelated and influencing what's going on in the body, and whether you're getting a disease or not getting a disease, and what can you do to help decrease risk, like really true prevention. And it just helped, it was like, okay, I'm going to do functional medicine. And that's kind of how I got more excited. Though I was always interested in integrative medicine, but functional medicine really gave me the tools and the organization as a way to think about the body in a different way that I found so helpful and usable, on that like patient to patient basis, and for myself for that matter. So
Wow. I mean, what a journey. And I can just feel kind of your energy and the passion of you wanting to help people. And so I think I already know, the answer to my next question, but can you share what motivated you to then write Breast Wellness and who did you write it for?
right. So, I really wrote it for for everyone, right? I wrote it for the general population because as I went through my training in functional medicine, I started to realize, okay, diet, of course, is really and critically important, and so is exercise, but there's so much more to somebody's overall health and wellness. And so there's so many other aspects we want to look at, when we're looking at, really personalizing care for somebody. And so I wanted to try, I came out with breast wellness tools to prevent and heal from breast cancer because I wanted to give everybody these tools to say, okay, what can I do today? And not that we can prevent every breast cancer, that's for sure, but what can I do to decrease my risk? Or if I got it, to decrease my risk of getting another cancer or another breast cancer. And so I brought together everything from the functional medicine approach to every, things we can talk about today, in terms of decreasing risk, lowering inflammation, decreasing insulin resistance, but also the lifestyle that's important, what foods to choose, how much exercise you need to do, why you want to avoid too much alcohol, but also the really important aspect of giving your body time to rest and heal and self-care and meditation. And in fact, when I first put together the content for this, I did it in 2015 as a DVD, and it was a video that we put out. And in there was meditations that a colleague of mine led people through, some yoga and meditations. But now 10 years later, there's not many people have DVD players, so we updated it, and we turned it into an ebook, but it can also be published on demand. And so it's an ebook or published on demand book with all of that information. And I wanted to update all of the references and that sort of thing. And the very cool thing about the book is that my daughter helped me write it. So she took all the information and helped me write it. And what's neat about it is when I was diagnosed, I hadn't had children yet. And there was a lot of concern, of course, because they recommended, and I did go through chemotherapy, that I wasn't going to be able to have children. And so my daughter is now 24, and she was, I got pregnant with her. Like, I went through chemo, I lost my period, then my period came back, and then a few months later, I was pregnant with her. And not that my oncologist wasn't so excited about it at the time, but it ended up all working out well. And so she's a great writer, and she helped me put together all the information and references and make it more easy for people to read and understand. And so I really wanted it for the general population, so they can get a sense of what does functional medicine mean from the lens of breast health, and what are things we can do every day that can influence our risk of breast cancer. And the cool thing about it is what we do that lowers our risk of breast cancer, and it decreases our risk of multiple other diseases as well. So
That's beautiful. And I love that you can do that together now as daughter and mom. But
so fun.
yeah, absolutely. And so I love that you said it's really for everyone because as you mentioned, you were 30, you were doing all the right things, and this still ended up having this diagnosis. And so
Mhm.
in that same kind of breath, what does breast wellness mean to you?
Right. So it's like, okay, so what are things that each of us can do every day that can keep their breasts healthy as well as keep their whole body healthy. And it's personalized. I mean, I think that's what we really focus on in functional medicine is the personalization of care. And so there's a lot of different chapters in this book, but I really encourage people to figure out for them where do they need to focus. So for example, for myself, I needed to, as I learned about all systems in my body and all of the lifestyle factors, when I was learning about functional medicine, I realized, okay, maybe I was eating well and exercising, but I wasn't resting enough. And I really didn't really deal well with stress, with how I dealt with stress and my mindset and from day to day. And I was working nights in the ICU and I wasn't really listening to my body and giving my body time to rest and every day. And so for me, it was, okay, I need to really focus on this stress reduction piece and the meditative piece. Like I had the exercise down, I had the nutrition pretty much down, right? And I had to really focus on this stress reduction piece and the gratitude piece. And I had to focus more on my microbiome and detoxification. But then for other people, it's a very different focus. They might really need to hone in on the diet piece and really get rid of some of the refined carbohydrates and sugars and increase their phytonutrient intake, right? So they might need to really focus on that nutrition piece more. And so I think what breast wellness is depends on the person and where they need to focus to create better health and balance in their body.
That makes a lot of sense. And I think what I'm hearing too is it's multifactorial in a way, like some of us have these strengths that, like you said, your nutrition was good, you're exercising well, but you needed to kind of lean into the gratitude piece and maybe the mental aspect of it. And so, in that same kind of realm, can you maybe share some of the most impactful strategies for improving that breast wellness? And I know you talk a lot about journaling. I'd love for you to share that a little bit more too.
Oh, absolutely. So, one of the things that we know, right, is that we can create a terrain in the body where cancer is less likely to grow. So again, I'm not saying we can prevent every cancer, but we can create the soil that is inhospitable for the growth of cancer in our own body. And so versus we don't want to create a terrain that helps feed the growth of cancer. So things that we know that encourage cancer growth are things like inflammation. So inflammation there's so many different ways that inflammation can present itself, but when there's inflammation in an area, that can encourage the growth of cancer. So I really work with people to help determine and what may be causing sources of inflammation for them. So that may be something like an underlying infection in the body or the standard American diet, right? That's really has the wrong fats and is really refined carbohydrates and processed foods. We also focus a lot on maintaining good insulin sensitivity, right? And decreasing insulin resistance because we know that cancer likes to grow when there's high blood sugar and high insulin. And so insulin is that hormone that gets released after a meal to help get the blood sugar normal. But if people are eating that standard American diet, right, with is really high in carbohydrates and low in fibers and that they may have higher spikes in blood sugar and insulin. And we really work to balance blood sugar and lower insulin resistance. We also speak a lot in the book about the microbiome because we know that there's such an interesting connection between the bugs in our digestive tract as well as our risk of breast cancer. So that connection is fascinating. When women have been given more rounds of antibiotics in their lifetime, their risk of breast cancer is higher, and partly because of this shift in the microbiome. So we talk about the microbiome. We talk about toxins. Unfortunately, there's a myriad of toxins that can be damaging to the cells in our body and can be carcinogenic. And so, what can we do to not only lower our toxin exposure, but then support our body to mobilize these toxins? I think is really critical and important. I was just gonna jump into the journaling. So,
Yeah.
like we know that lifestyle is critical. And as we've talked a lot about diet and exercise and how important they are for everything from creating this healthy terrain to improving insulin sensitivity, lowering insulin resistance. But we know that journaling is a really wonderful way to help with managing stress, and it can help with shifting our mindset around an area that can really have an impact on stress. And for me, I started journaling when I was going through this process because I really didn't know what else to do. And I started a gratitude journal at that time where just wrote down 3 things every day that I was grateful for. And it was amazing how much it shifted my mindset and just the way that I interacted with the world around me and the amount of joy I had on a day to day basis. And so, I think journaling can be a really powerful thing, especially, I mean, maybe always, but especially when you're going through something that's really challenging. And it can be a really wonderful way to help with all of the overwhelm and stress that can come with that. So I think it's a great tool.
Absolutely. And so my follow-up question, I guess, is it like the physical act of doing this in such a digital world? Do you recommend, pen and paper, or can you do it on notes on your phone? Like, is it the act of physically doing it, or is it just, processing that in your head?
Yeah, I honestly, you probably can do it on pen and paper or on the notes in your phone. So I think it's the process of writing down your thoughts, whether it's physical or digitally. But I will say that there's so much benefit from getting off of our devices that I would encourage people, if they're, to try the pen and paper route. And because there's so many beautiful journals out there. And I think that's a really nice thing to help us disconnect from, the machines and the digital and the lighting and that sort of thing. It's something you can do in bed with sort of softer lighting that can be really calming as well.
No, I love that. And I think I would prefer that as well, but just wanted to ask. And so we've talked about food, nutrition a little bit, but what are some of the best foods that women can eat to support breast health and maybe reduce that cancer risk?
I think one of the best things for us to all think about, and especially when it comes to decreasing cancer risk, is phytonutrients. So, phytonutrients are these components in our plant foods that have all this amazing impact on the health of our body. So, phytonutrients can be anti inflammatory, they can support detoxification, they can feed the microbiome, the good bugs in your gut. And so many people just don't get enough phytonutrients. And so, when you want to think about just getting more plant foods that have a variety of different colors to get all sorts of different phytonutrients in your diet, we'll always encourage people. So every day, did you get a plant food from every color of the rainbow? So did you get something red, like your red peppers, or orange, like your carrots, or yellow, like your squash, green? We always talk about I always talk about cruciferous vegetables, broccoli, cauliflower, cabbage, kale. Those cruciferous vegetables are really rich in glucosinolates, which turn into sulforaphane, which help the body make glutathione, which really helps with detoxification. So, and again, purple and white and tan, like mushrooms. And so, all of these things are these plant foods that also include things like spices, teas, even coffee. Are these phytonutrients are really health, they have a lot of health benefits for us. So I will say 8 to 10 servings of phytonutrients in a day. And sometimes people think, "Oh my gosh, how do I do that?" But if you just get more, like a variety of vegetables in your omelet in the morning and a salad with a lot of different vegetables, use spices, it's doable, but that's, I think, the area that most people need to do the most work in, when in terms of improving their diet.
That makes a lot of sense. Eat the rainbow, get the variety. I've been hearing more and more about, microgreens and having protective anti-cancer benefits. Can you maybe tap into that a little bit? I'm not sure, what's the latest and what the actual science says.
So, one broccoli sprouts are a wonderful microgreen, right? So you can grow broccoli sprouts yourself or purchase them, but they are a great source of these glucosinolates, which make sulforaphane. And in fact, broccoli sprouts have so much more of this sulforaphane than even broccoli, maybe even 300 times more, huge amount more. And it can be something that you add to your, salads or smoothies, and they're fun to grow. I on Instagram, I did a post, it was a while ago now, but showed like all the steps in growing them yourself, and they're yummy too.
Hmm. I'll have to check that out. And so, are there any specific foods maybe that breast cancer survivors should prioritize then or avoid for ongoing wellness?
I mean, I think the best thing to avoid is a meal that is going to spike your blood sugar and spike that insulin release. So you always want it whenever you sit down, you want to think, okay, is there a good source of protein in this meal, right? Whether it's animal protein or vegetable protein. I like a mixture of both, beans, legumes, tofu, nuts, seeds, chicken, fish, salmon, meats, a good source of protein, a good source of healthy fats, and a lot of fiber. And when you mix those things together, you don't get as much of that blood sugar spike and you don't get as much of that insulin spike. And so I think that's the key, as opposed to, right? Like, what I used to always say this, like in college, we'd go and we'd have pancakes and orange juice for breakfast. And like, it was like, what were we thinking? Right. And then you get a headache like an hour later, and you'd be like, why do I have a headache? You know? So because that's just gonna, it's easily digested, quickly absorbed, causes that spike in blood sugar and insulin, and then your blood sugar can plummet afterwards. So you really want to think about combination of your foods and just having more and more of those phytonutrients with every meal. The other thing we do know with the research is that there is a strong connection between alcohol and breast cancer risk. Unfortunately, it is a linear association. And as a woman's alcohol intake goes up, so does her risk of breast cancer. And so for women at high risk for breast cancer who have had breast cancer, we go even lower than that moderate intake of alcohol. So in general, when I'm working with patients, I say for women, stay 5 or less alcoholic drinks a week. But for women who've had breast cancer or at higher risk or want to be even more careful, we'll keep it at 1 or 2 drinks a week, maybe. So because of that strong association.
Lots of things to think about for sure. And so I want to talk a little bit about prevention. In breast wellness, you really stress the importance of regular breast exams. How can women conduct a self exam? Why is it such an important process and part of maintaining breast health?
Right. So, it's important to point out that both mammography, ultrasounds, and even breast exams, breast self exams, or breast exams by your clinician are really early detection, right? So they're finding cancer early, not really prevention. They're early detection, but they save lives. They saved mine. I was trying to learn how to do breast exams on my patients because I was in my residency program. So I was doing them on myself. Not really worried again that I was going to get breast cancer, but I was monthly doing my breast exam. And that's when I found this lump. And the month before, I couldn't feel it. I'm sure it was there at some level, but it was not at a point where I could feel it. So that the benefit of breast exams is, first of all, just getting to know what your own breast tissue is like. We typically say the best time to do it, if you're still cycling, if you're getting your period, is right after you get your period. Because as many women know, right before their period, their breasts may be more lumpy, bumpy, or sore. And so the best time to do it is right after your period. And then that's a way to remember, okay, monthly. And I would say first look in the mirror, look at the shape, see if you see any shifts or changes or anything that looks different than it has typically looked before. And then, using the pads of your fingers, you just want to slowly you don't need to push too deep, but slowly just in circular motions, go around each breast all the way to the center and then go up into your armpit. And you just want to feel for anything that feels different. And if you do feel something that's changed or different, you can just bring it to your clinician, your physician, and have them take a look at it. It does get tricky for some women. They are more lumpy and bumpy. And especially when we go into perimenopause, there can be a lot more lumps and bumps that show up that can make the breast exam more complicated, but it is a good way to just get to know your own body, and then you'll be able to alert somebody to it if there's any changes.
Well, thank you. And thank you for clarifying. That's, self exams, detection. Can we then talk a little bit about, prevention? What can we do before?
Right. So, I mean, the prevention piece is really saying, okay, what do I need to do from a self care perspective? Right. So, if you're thinking about what are things that help with my self care, whether it's, am I exercising enough? Am I making the right food choices? Am I giving my body time to sleep and rest? Am I doing my meditation and stress reduction? Am I getting together with other people and having good community? And that's a great thing to think about, like within those five sections, where do I need to focus, right? Ask yourself that question. Where do I need to focus? What thing may I start to say, okay, I'm going to implement this to help improve my own health? And for a lot of people, they may choose to work with a clinician to help them, or with a nutritionist or an exercise physiologist or a health coach, as a way to say, okay, what can I do for better self care? And the nice thing about self care is, not only does it improve our health, but it also just makes day-to-day life more enjoyable. And I think that's important for us to say, okay, where do I need to focus to take care of myself? So often we just get wrapped up into the gotta do, gotta do, gotta do, as opposed to, okay, where do I need to focus?
Absolutely. And so I'd like to shift into research for a little moment. Research is showing us that bone health should be really top of mind as part of breast cancer recovery. And so I have a study here, for example, published in Breast Cancer Research, compared 211 breast cancer survivors with cancer free women and found the risk of osteopenia or osteoporosis to be as much as 68% higher. Can you tell us why this risk of bone loss increases so much?
Yeah, the biggest reason that we see this, and this is very true. This is definitely, when women have gone through breast cancer treatment, they have to be more careful about their bone density, than though we should all be careful about our bone density, but especially women who've gone through different breast cancer treatments. And that's just because we know there's an association with estrogen and bone density. Estrogen protects against bone loss. And so when you go through some treatments that decrease estrogen levels in your body, that can then have an impact on bone density. So, chemotherapy, as I mentioned with myself, but many women know that when they go through chemotherapy, they will lose their period for a period of time. For some women, they don't get their period back, and they go through menopause at a much younger age. And as a result, that is going to impact their bone density. Ovarian suppression, that is often used as part of breast cancer treatment, also is going to decrease their hormone levels in their body and therefore impact their bone density. Aromatase inhibitors are a very common medication that it's used when a woman has had an estrogen receptor positive breast cancer and they're postmenopausal. And we know that aromatase inhibitors, what they do is they lower estrogen levels in the body significantly, and they are associated with a lower bone density. And it's recommended that if a woman is going to go on an aromatase inhibitor, she should have a baseline DEXA scan bone density, and then that should be repeated every 1 to 2 years while on that medication. And even tamoxifen, when it's used in premenopausal women, which is usually when it's being used, women who haven't gone through menopause yet, it is also associated with lower bone density as well. And so many of these breast cancer treatments are associated with a decrease in bone density. So it is something we need to be on top of.
Thank you for kind of explaining that landscape a little bit. And so, as with so much with health, hormones and what I'm hearing play such a significant role in both breast and bone wellness. And so, how do we get the balance right? Particularly in regards to hormone replacement therapies and things like that.
It's I think what's important, as for me as a clinician, is that we work with each person as an individual. And so, we do know that hormones are critically important for bone density, but we also want to be able to, once the hormone has done its job, be able to metabolize it and get rid of it out of the body in a healthy way. And so when I'm working with a person, and I'm trying to find that right balance between breast health and bone density, I'm thinking about what are their individual risks and areas that we need to focus on for them. And then once, we want to also think about all those other things that really impact bone density even outside of hormones, right? So, of course, we may be thinking about using hormone replacement therapy, but when in let's say a postmenopausal woman, right? But when we do, we want to make sure that that person is able to, after the hormone has done its job, be able to metabolize it and get rid of it. And in terms of breast cancer risk, it's way more complicated than just, of course, we think about your own body's estrogen and your ability to metabolize it, but it's all of these endocrine disrupting chemicals or xenoestrogens, these things from the environment that can impact the estrogen receptor that we also have to be really concerned about, because we know that there's such an association with these chemicals from the environment that are impacting our hormone levels in our body and our risk of breast cancer.
And so, estrogen hormones, in preparation for this interview, I learned kind of a new term. And so, external estrogen. What is external estrogen and how does that exposure impact our breast wellness?
Right. So xenoestrogens, which are part of this external estrogen. So external estrogens are things that can impact estrogen levels in our body and impact the estrogen receptor. Some things in there are these xenoestrogens. These are these compounds from the environment that include things like endocrine disrupting chemicals that can impact the estrogen receptor and impact how our hormones work. And unfortunately, there's just so many of them in our environment, and they have a real detrimental impact on our health. So includes everything from the plastics, BPA, right? That was one of the first xenoestrogens that we really learned about. The first chemicals from the environment that we learned were impacting the estrogen receptor. It was like in the 1970s at Tufts University. They were doing research on breast cancer, and they realized that their test tube was impacting the results. And that's when we started to learn, okay, BPA, this hard plastic, is impacting the estrogen receptor and these results. But then things like phthalates, which is another types of plastic in cling wrap, parabens in your makeup, your moisturizer, and some foods, unfortunately, and pesticides and herbicides. All of these things are chemicals from the environment that can unfortunately impact our hormone balance. And what's tricky is that sometimes these exposures occur at a very way, way, way away from when the person gets breast cancer. So a lot of research is being done to show that you may have an exposure to some of these xenoestrogens as a fetus in your mom's belly, or when you're going through puberty at a very young age, that changes your breast tissue in a way that impacts its risk of developing a breast cancer later in life. So it is unfortunate, but the exposure, of course, is important for these xenoestrogens, but so is the timing of the exposure. But also, we know our lifestyle impacts it as well. Like whatever we can do to support detoxification is critical. So these endocrine disrupting chemicals are something that we really try to help women figure out, okay, how do I avoid them? How do I or decrease my exposure as much as possible at this point?
Is there kind of like a resource that you use, a tool, an app to help with that? Or is there, a section in your book, anything that we can refer to?
Definitely in my book, I talk all about these. And the Environmental Working Group is a really wonderful app that I send a lot of people to, that you can look up your makeups and, moisturizers and sunscreens and all these things to see, okay, does this contain, or what's the safety of this product? Very helpful.
What is estrogen metabolism and how does that really play a role in breast cancer risk?
Yeah. So, as I was mentioning a little earlier, once estrogen, it's done its job in your body, right? So, your body makes estrogen, it's done its job, then the body needs to get rid of it. And what a lot of research has shown is that uh, people will metabolize that estrogen in multiple different ways depending on their genetic makeup. And so, that's something we think about and we look at when we're balancing people's risks. And then there are things we can do that can influence how somebody metabolizes these estrogens. So that's an area also where these cruciferous vegetables come up a lot, because we know that the components in cruciferous vegetables, from the glucosinolates, right, which make sulforaphane, and you may have people have heard of DIM or I3C. These are these phytonutrients that help with encouraging healthy metabolism of the estrogens. And so, in addition, we have to be able to methylate. That's a process of taking these methyl groups to get rid of the unhealthy estrogens out of the body. We need to be able to, when you're supporting detoxification, you're making sure somebody's having regular bowel movements, that they have a lot of fiber in their diet, because that helps mobilize and move these estrogens out of the body as well.
That makes a lot of sense. And so we talked a little bit about diet and exercise, touched on it, but nutrients. I'd really like for you to explain maybe what role do you see nutrients like vitamin D and calcium, magnesium, vitamin K2 kind of playing a role in maintaining healthy bones, but particularly for women at risk or recovering from breast cancer?
Yeah. So, you know, nutrients, right? Vitamins and minerals, they are really involved in so many different processes in the body, from helping all of our cells work better. And of course, good nutrition is really critical for healthy bone density. And so when I'm working with somebody and I'm saying, okay, I want to make sure they're working to maintain good, strong bone density, one of the things I'm making sure is, okay, are they getting a really good, healthy, whole foods diet? We don't want to waste our calories on junk food, right? The reason we call it junk food is it's just devoid of vitamins and minerals, and it's high in calories. So it doesn't mean we never eat any junk food, but you really want to keep that to a minimum, because you want to think about nutrient density. You want to think, okay, I want to make on my plate that I'm eating, I want my foods to be as nutrient dense as possible, meaning they have more vitamins and minerals and phytonutrients per calorie and not nutrient deficient. And we want to make sure people are digesting their food well and they're absorbing their food well, because that really has a huge impact on bone density. And vitamin D is such a critical vitamin, right? It's a critical fat soluble vitamin that's important for the immune system, right? We know that when we are vitamin D deficient, we get sick more. So vitamin D is critical for the immune system, but it's also critical for bone density, right? It's really necessary for making good, strong bones. And so, and you mentioned K2 as well. Vitamin K2 is another fat soluble vitamin that helps direct the calcium that we're eating or taking as a supplement and get it into the bones so it can be used for building strong bones as opposed to going elsewhere in the body. So, having a good calcium that has vitamin D and K2 in it and good minerals for building strong bone is really critical for having building good, strong bone density.
For sure. And I think that's kind of a perfect segue into my next question. Can you talk about your experience with AlgaCal in your clinical practice?
Yeah, we at the Ultra Wellness Center use AlgaCal a bunch. We really like it. We enjoy how it's a very well tolerated calcium, but it's also not just calcium, right? So it has a wide variety of minerals in it that are necessary for building strong bone, and has vitamin K2 and D in it. So it's really a nice supplement that we use often and find patients tolerate really well.
Yeah, appreciate that. And I love that you acknowledge one of the roles of K2 in directing that calcium to your bones and keeping it out of soft tissues and arteries, because it's not always so known. And so I appreciate that. In your experience as well, what makes AlgaCal stand apart from maybe other bone health supplements on the market?
Yeah, I mean, I think that the two things that I would say help it stand out is just it's well tolerated, and it's just a wide variety of minerals within it. So it's just way more than just calcium, right? It's got a lot more nutrients in it that help with building strong bone.
hmm And so, can you share any cases or specifics where AlgaCal products may have helped a patient improve their bone health or overall wellness?
Yeah. Yeah. I mean, as I said, we use it a lot. I had a woman just the other day and she came to see me. She was like in her 60s, and she came to see me for multiple different things, including maintaining her bone density. So she had just had a DEXA scan that showed that she had some almost osteoporosis. So she was borderline osteopenia, osteoporosis when she came to see me. And so we really worked on her with this comprehensive approach, right? So we said, okay, let's make sure you're building up your bone density by building up your lean muscle mass. So we made sure she was getting enough protein, she was digesting enough protein, she was absorbing enough protein from, she had good digestive system. She was doing exercise, she was doing things that worked to improve her lean muscle mass. And we put her on algae cal. We made sure her vitamin D was in the optimal range. She had a remote history of breast cancer. So I kind of liked her vitamin D between like 50 and 70. So we made sure she was getting enough vitamin D to get to that level. And, so when we also made sure, okay, she's not getting too much caffeine. So we cut back on her caffeine and alcohol intake. And when we repeated her bone density, she just came back to see me. She had maintained from the first one, and she actually improved a little bit in terms of her bone density, not just maintained, but improved a little bit. And this is a woman in her 60s who is not going to be taking hormone therapy because she's got this history of breast cancer. So you can maintain and even build bone density a little bit with a comprehensive program.
No, thank you for sharing that. And I think, for us, that's exactly why we do what we do. And just hearing how you kind of approach each patient, like you said, bio individual, making sure that, you're doing all the right things, but thinking of all the things too. And so we've talked a lot about controllables and what can we do to decrease our risk, but there are some things that we can't control. And so one of those is genetics. There's a genetic component to both breast cancer risk and also osteoporosis. And so how big of a role does genetics play, and how can maybe someone overcome this or combat this because they have that?
Yeah, so we look at genetics a lot, both by asking like a detailed family history as well as doing some panels that look at genes, everything from like the vitamin D receptor to some genes that activate vitamin D or impact bone formation. And so genetics do play a role. And I think that's important when you're individualizing your care with your patients. So it's not like hormone therapy is never good for somebody or hormone therapy is always good for somebody, right? We know we need to individualize care. That's critical when you really look at family history and genetics. But genetics are just one piece of the puzzle. And things like, for example, the vitamin D receptor, when people have variations in that gene, we just know that we need to get their serum vitamin D level to a higher level for them to have the benefit of the vitamin D. And so there are some things we know about with genetics that say, okay, this person really needs to get that vitamin D up more when we do testing, or this person may really benefit more from calcium supplementation than somebody else, right? So I think genetics are really helpful to help us know where to focus, especially with intervention and supplementation.
I love that. You're putting a kind of really a positive spin on it because like you said, we're able something you can't control, maybe that genetic component, but because of that information, we're able to, adjust based off of that. And so thank you. Before we close, I'd love to end with a quick round of rapid fire questions. Just a few fun, fast paced prompts to get your gut reactions. Think short and sweet, whatever first comes to mind. What breast cancer myths and misconceptions do you encounter most often?
I think one of the myths that, women will express is, okay, I just had my mammogram. I don't need to worry about breast cancer until next year, right? And I think that that's definitely not true. As we mentioned earlier, mammography or breast exam or ultrasound or MRI, right? These are all early detection. And we know that what we do every day can impact our risk of getting cancer. And the body has this tremendous ability, our immune system has this tremendous ability to go around and find abnormal cells and gobble them up with when we are doing those things to, those self-care things, the rest and the recovery and the sleep and the good nutrition, and creating that terrain where cancer is less likely to grow.
If there were one piece of advice or action step you wish all women would take away from reading breast wellness, what would it be?
So that that there are things we can do that influence our risk of getting breast cancer, and that I would focus on getting those phytonutrients every day, those that eating from the rainbow, those 8 to 12 servings of phytonutrients every day.
What are three things breast cancer survivors should do to protect their bone health?
Ah, so exercise, exercise, exercise. Oh, wait, but I'll give you some more. So, strength training a couple days a week, making sure you're getting adequate protein and, not drinking too much alcohol. So, not only is alcohol concerning in terms of breast cancer risk, but also bone density. And so, keeping your alcohol intake to that moderate 5 or less drinks a week, or for some women, even lower.
Is bioidentical hormone replacement therapy safe?
Yeah, it can be. Absolutely. So I think that as we mentioned that we want to take each woman as an individual and use hormone therapy to, for what they need it for. So what their symptoms are, or if they're using it for bone density, or if they're using it for just longevity and prevention. So we kind of get a sense of why are they interested, or why might we recommend it. And then, as you mentioned, bioidentical is important. You want to go for those bioidentical hormones. And for estrogen, transdermal. We go through the skin, right? So whether it's patch or cream, it's through the skin. And so those are some of the things you can think about. But yes, it can be a total safe thing.
What are the most common root causes of osteoporosis?
I would say lack of lean muscle mass. So when women either didn't ever develop as a young adult enough muscle, or they've lost a lot of muscle, I would say that's probably the biggest thing we see as a contributor to low bone density.
What are the key ways you support patients with osteoporosis at the Ultra Wellness Center?
Yeah. So we ask the question why? What's going on? Why does this person have osteoporosis? Where did it come from? Right? Is it because of issues when they were younger and they never built strong bones, or do they have a problem with digestion and absorption of protein and minerals? Do they need a lot of extra minerals, including calcium, to build strong bone because they're not digesting and absorbing well? Where is their exercise at? What's their lean muscle mass like? We of course put them on a good whole foods diet and get them doing some strength training at least 2 days a week with a trainer if needed, so that they can do it with the proper form and get the most benefit. But you want to ask that question why, and what's going on in the body that has resulted in this low bone density.
Dr. Boham, thank you so much for being here today. That was so incredibly insightful and honestly just a really great reminder of how much power we do have when we take that whole body approach to our health. If you want to dive deeper into what we talked about today, definitely check out Dr. Boham's book, Breast Wellness: Tools to Prevent and Heal from Breast Cancer. It's packed with practical, science-backed strategies that anyone can start using. And she's also put together a free resource called 15 Tips for Breast Wellness. We'll drop the links for both in the show notes so you can check them out. Dr. Boham, before we wrap up, where can people find you, follow your work, or get more of your resources? Anything you'd like to share?
Yeah, so I am a physician at the Ultra Wellness Center, so ultrawellnesscenter.com for my practice, drboham.com for my personal website, and then Elizabeth Boham, MD for Instagram, and I think Facebook's the same. But Moni, it was great to be with you, and thank you for having me.
Absolutely. All right, that's it for today. For everyone listening, thank you so much for tuning in. If you want more expert interviews, real conversations, and bone health tips that actually make a difference, be sure to subscribe to the AlgaCal YouTube channel. Take care of yourself, and we'll catch you next time.